Okay, so what we are going to study today is about the mumps virus. This mumps virus, it comes under the family Paramyxoviridae and the genus is Rubella virus. What is mumps? Mumps, it is an acute infectious disease which commonly affects the children and it is characterized by non-suppurative enlargement of the parotid glands. So what are the parotid glands? Where is it located? Can you see this diagram over here? So in this diagram, we can see there are three different types of glands. This is the sublingual gland, this is the submandibular gland, and this is the parotid gland. So this mumps virus, it causes enlargement of this parotid gland, which is located in this area. Okay, then if we talk about the properties of the mumps virus, in this particular diagram, you can observe that the mumps virus, it has got certain protein and the important proteins are the HN protein and the F protein. So the function of this HN protein and F protein which is present in this virus is that it performs agglutination. It helps in agglutination of the RBCs. Then after this agglutination of the RBC, or you can also say it as heme agglutination, after heme agglutination occurs, it is followed by hemolysis at a temperature of 37 degrees centigrade, which is the normal temperature of every human being. So at that temperature, we can see that the virus, it performs heme agglutination and hemolysis. If we want to do a cell culture of this virus, it is possible to grow it in chick embryos. And within the chick embryo, it is possible to grow it within the amniotic cavity for the primary isolation and in the allantoid cavity after the adaptation. In the eggs, this is inoculated at 6 to 8 days and then incubated for 35 degrees centigrade for 5 days before the harvesting is done. Then this mumps virus, it is labile. Okay, it is rapidly inactivated at room temperature or by exposure to formaldehyde, ether, or ultraviolet light. It can be preserved at minus 70 degrees Celsius or by lyophilization also. And antigenically, this mumps virus, it is stable. It has only one type of serotype, and there are two complement fixing antigens that has been recognized, and they are the soluble antigen and the viral antigen. The soluble antigen is designated as S and the viral antigen is designated as V. So whenever this mumps virus causes infection, as I told you, the parotid gland is affected, and hence we can see in this other picture here that due to the enlargement of the parotid gland, this area that is which is nearby the cheek and nearby the ear and the throat, this particular area enlarges. We can see swelling of this particular area, and this swelling is along with pain, okay, which is and the area, it becomes very tense and hot, and it lasts for around 10 days. Okay, now moving forward to the clinical features of this virus. How is this infection caused? The infection is acquired by inhalation, and probably it can also be it can also transmit through the conjunctiva. The virus, it replicates in the upper respiratory tract and the cervical lymph nodes, and then it is disseminated through the bloodstream to various organs. So that means once it is acquired into the body through inhalation or through the conjunctiva, the virus starts replicating. Where the replication will take place, it mostly takes place in the upper respiratory tract. And after that, replication may also be seen in the lymph nodes, in the cervical lymph nodes, and then it spreads from those areas where the replication has occurred. From those areas, the virus will spread through the bloodstream and it will reach various organs of the body. The incubation period is long. It will take around 12 to 25 days. And then the parotid swelling, the swelling of the parotid gland is the first sign of illness that is observed. Then it may sometimes also be preceded by a bit of malaise in that person. The parotid swelling is unilateral to start with, but may become bilateral. That means it may initially start with only one side of the parotid gland, and then gradually it may involve both the sides, both the parotid glands. Then along with the swelling of the parotid gland, it is also accompanied by fever. The person will undergo through high temperature, then there will be pain, local pain in those areas, then there will be tenderness, but the skin over the gland is not warm or it's not erythematous. Okay, it doesn't redden. So this is what it is seen. Then parotitis is non-suppurative. So that means we don't observe any pus in this infection, during this infection, and it usually resolves within a week. So it just takes around few like one week to, or it can take almost 10 days, 7 to 10 days it takes in order to complete the in order to like this whole thing to get over. Okay, then however, involvement of the extraparotid sites may be more serious. Sometimes what happens, this infection, it spreads from those parotid areas to other areas also. So if that happens, that becomes more serious. Such involvement may sometimes occur even in the absence of parotitis. So it's the most common symptom or sign of mumps is the enlargement of the parotid gland. But sometimes it occurs that it is seen that even other parts of the body are affected in absence of parotitis. That means the parotid glands may not be affected, but the other organs of the body may be affected. Okay, so that is a major problem because it becomes very difficult to identify that this is the mumps disease that is occurring in that person or the person is suffering from, because when it is affecting directly the parotid gland, so it is easier. The doctor seeing the sign, that doctor can very easily identify the disease. But when it's affecting the other organs, so it becomes a little bit of like confusing in order to identify it. Then another complication that occurs, and it is seen in the male, and that is called epididymo-orchitis, or it's also said just orchitis. Okay, that's another complication that is observed in male, that is known as orchitis. Now this orchitis is a kind of complication that is seen in the post-pubertal male patients. And here the problem is where it occurs in the testis, where the testis becomes swollen and acutely painful with accompanying fever and chills. Orchitis is usually unilateral, but when it is bilateral and followed by testicular atrophy, then sterility or low sperm counts may result out of this. Then in 60% of cases, it has been seen that the central nervous system is also involved, and here the CSF is involved in this case, and 10% show symptoms of meningitis. It has been seen that mumps that it causes 10 to 15% of cases of aseptic meningitis. Okay, then mumps meningitis and meningoencephalitis usually resolve without any other sequel, but one problem might occur or result into, and that is deafness. Otherwise, no other such kind of complications occurs after mumps meningitis. But deafness may sometimes result in some persons. Then mum meningitis may occasionally occur in the absence of parotitis. Now, this is a little bit, as I told you, when parotitis doesn't occur, so it becomes difficult for the doctors to diagnose the disease, and that usually occurs when a person suffers from mumps meningitis, and there is absence of parotitis. When diagnosis, it solely depends upon the laboratory evidence. Okay, it is not the clinical evidence on which the uh, diagnosis depends upon. Like when a person comes to a doctor with a swollen parotid gland or a swollen cheek, the doctor will immediately at least think that yes, the person might be suffering from mumps. But if it's not happening, but the person is showing some other symptoms, and which is actually the symptom of a mumps meningitis, then in that case, the only way how it can be identified or diagnosed is by the laboratory evidence and by taking samples of the CSF. Okay, so the virus can be grown readily from the CSF in the early phase of meningitis. So that is about the clinical features of mumps virus. So here we can see on the screen, here we find that the symptoms that is mostly seen are swelling of those areas, painful salivary glands, one or on both the sides. You'll face pain with chewing, while chewing or swallowing. You'll have high fever, weakness, and fatigue. Then the epidemiology of this disease. So this mumps, it is endemic worldwide, but has become less common in the advanced nations, and that is because of immunization. It often occurs as epidemics in children of 5 to 15 years of age, and also in young people living in groups such as in army camps. Household spread is common. Humans are the only natural host, and the source of infection is a patient in the late incubation or early clinical stage of illness. No human carriers or animal reservoirs exist. Then this infection, how is it transmitted? It is transmitted by direct contact, then airborne droplets or fomites contaminated with saliva, and also possibly urine. The virus is detectable in the saliva for about a week before and a week or two after the onset of parotitis. So, as I told you just now, that this infection is transmitted. The only way how it is transmitted is when we come in contact with droplets that has the virus present in it. So that droplet may be of saliva, or it may be of urine. So any of the way you can this virus can be transmitted, and the presence of the virus in the saliva is found to be either a week before the parotitis or a week or two after the onset of parotitis. Within this area, this virus is found to be present in the saliva, and the rate of infection is high when it is about a day or two, just a day or two before parotitis occurs. In that time duration is shows high peak of infectivity. The virus is also shed in the urine for up to 2 weeks after the clinical symptoms begin, though its role in the transmission of infection is not clear. And if a person gets infected with this mumps virus, one attack of mumps, it provides lasting immunity, so that the second attack do not occur. So it is like acquired immunity, but then this immunity is long lasting. It will last for the lifetime once you get attacked by the mumps virus. And the immunity, in regards to immunity, the infection leads to antibody response against both internal as well as surface antigens. As I told you, there are two types of antigens which are present, and they are internal and surface antigen. And the infection which leads to antibody response against, it is against both the types of antigens. The antibodies to S antigens, it appears early, within 3 to 7 days after the onset of symptoms, but it disappears after about 6 months. Then demonstration of antibody to the S antigen, it indicates current or recent infection. If we go for an antibody test, uh, if we go for an antibody test, then we may find that if we find the presence of this antibody, then that will indicate that the infection is a current or recent infection if S antigen is present. Then antibodies to V antigen take about a month to appear. So if we go for another examination and we find the presence of antibodies against V antigen, so that will indicate that the infection had taken long back, okay, about a month to appear but persists for years. So that the antibodies for V antigen, it stays in the body for several years. Then, as I've told you already, that this virus, it causes heme agglutination, right? So the anti-heme agglutinating antibody, it correlates well with immunity to infection. Even subclinical infection lead to HI antibody, heme agglutination antibody, and resistance to infection. Then after that, what are the different processes, how the lab diagnosis can be performed for this particular virus? Now, since the virus is found to be present in the saliva, so we can take samples from the saliva. It is also told that the virus can be, it spreads through, sometimes it may spread through urine also, so we can also take urine samples. And since it also causes meningitis, we can take the CSF for the diagnosis. So from the saliva, it is taken within 4 to 5 days, from urine up to 2 weeks, and from the CSF it is taken within 8 to 9 days after the onset of illness. And this specimen, after we collect, has to be immediately inoculated. The reason why it has to be immediately inoculated is because the virus is labile, so it may get destroyed very soon. So that is the reason we need to inoculate it as early as possible. And the specimens are inoculated into monkey kidney cell cultures, and then or in the egg, amniotic cavity of the eggs. So where there the virus growth can be detected. How can it be detected? When it performs heme absorption. That means the virus will attach themselves to the heme, that is the blood cells, and then they are identified by the heme absorption inhibition using specific antiserum. Then, and again, some cytopathic changes are also seen, but that is not much reliable. Then this isolation may take place within for 1 to 2 weeks, within 1 to 2 weeks, and then if you want to see a more rapid result, that can be obtained by immunofluorescence testing of the infected cell culture. So this may become positive as early as 2 to 3 days after inoculation. Okay. So these are the ways how we can perform the lab diagnosis. Then we can also go for ELISA, that will help us in identifying this. Then for the CF test, so this can also be performed. So these are the ways how we can identify the presence of this virus in the human body or in the sample. Then finally the prophylaxis. Now what is the prophylaxis of this particular virus? An effective live virus vaccine. This is available against the mumps virus. Okay, live virus vaccine is available, so that is very effective. So that can be used as one of the prophylactic measure. And then there is a vaccine which is the MMR vaccine. This vaccine is given as a single subcutaneous injection. It is either given alone, or it is in combination with the measles and the rubella vaccine. Okay, so which is in altogether known as MMR vaccine. So that can also be used for as a prophylactic measure. So these are the different, ways how you can take measures to prevent the occurrence of the mumps disease by the mumps virus. So I have completed all of the points.